video is about nasopharyngeal carcinoma. This case study presents the case of a 57-year-old Bidayuh man, Mr. B, who is diagnosed with nasopharyngeal carcinoma, stage 2, with underlying hypertension and diabetes mellitus. The study aims to determine the disease process, management and the outcome of the plan of treatment and specific nursing care plans. The data collection of the patients are from interviews, observations and clinical examinations.
Why is this case interesting? Because it is common cancer in Malaysia. Bidayuh were reported the highest incidence of NPC, and the diagnosis are challenging because mimicking other disease like temporomandibular disorder and confusing sign and symptom.
Mr. B was admitted to receive his second cycle of chemotherapy. Mr. B is a 57-year-old farmer from Syrian. He is married, has 4 children, and lives together with his wife and his children. In addition, he is a Catholic. The area where he lived is near the hills. This is a table that shows his vital signs and his complaints during the interview. Mr. B appears active and cheerful. Upon interview, he speaks in a calm manner and very cooperative with procedures. He is able to ambulate and maintain hygiene. When asked, he is able to recall incidents from the past, which means he has no problem regarding his memory. Around April this year, he realized there was an abnormal swelling around his neck. He also verbalized, although it swells, there was no pain when touched. He also mentioned that he felt abnormally cold when taking a shower, and his appetite has also reduced, which is evidenced by his weight changed from 75 to 76 kilograms to 68 to 69 kilograms over the months. He was diagnosed with hypertension and diabetes mellitus in early January this year. None of his family member was diagnosed with cancer, but his mother was diagnosed with hypertension. In addition, his brother and sister were diagnosed with diabetes mellitus. He only drinks alcohol occasionally, specifically during Gawai Dayak festival. He also denied drinking until drunk state. He verbalized, "Currently do not dare to drink due to the doctor's instructions to avoid drinking because of the presence of illness." He has ceased smoking approximately 21 years ago. At home, the routine is once every morning. Meanwhile, during hospitalization, it changed to once every few days. He also mentioned having a hard brownish stool, probably due to a different diet. He verbalized increased frequency of urinating, which is also affected by his water intake. In addition, the frequency might also be influenced by his chemotherapy. He mentioned there is no abnormality when urinating, such as no pain or any abnormal urine color. He has no known allergy to any food or drugs. He is able to perform activities of daily living such as eating, taking showers, or ambulating independently. He has no limitation in movement. His skin is intact, dry and no redness seen. Inspection, there is slight swelling around his neck but any growth in the nose is not seen. Palpation, a soft and palpable mass can be felt around the neck area. Percussion, this assessment is not done on the patient, in order to avoid breaking down of cancer cells which can travel around the body via blood vessels. Auscultation, this assessment is not done on the patient. Diagnostic test that has been performed before the treatment start for Mr. B were computed tomography, CT, magnetic resonance imaging, MRI, bone scan, biopsy through nasopharyngoscopy and X-ray. The biopsy is performed through nasopharyngoscopy and has confirmed it is nasopharyngeal cancer. Bone scan is done on the 8th of October 2019 to find out if the cancer has spread to the bone, where the result has stated that there is no bone metastasis. He verbalized concern regarding financial as he is the breadwinner of the family and now he is unable to do his work due to illness. Nasopharyngeal cancer is a type of head and neck cancer where the cancer cells grow in the nasopharynx. The nasopharynx is located at the upper part of the throat, behind the nose, near the base of skull and at the end of the trachea and esophagus. Cancer starts to develop when a change in gene causes one or more cells to divide uncontrollably that may result a tumor. Nasopharyngeal cancer is a type of benign, or malignant cancer, forming in the nasopharynx, and most commonly starts in the squamous cell, lining the nasopharynx. Signs and symptoms of nasopharyngeal cancer includes swelling in the nose or neck, sore throat, difficulties in speaking or breathing, epistaxis, hearing problems.
So next, we will move to management and outcome. For the medical plan, the patient is to continue on the second cycle of the cisplatin-5-fluorouracil chemotherapy and also continue with the medications such as atenolol, amlodipine, metformin, glycazide. So now I will talk about how the second cycle of the cisplatin-5-fluorouracil chemotherapy treatment performed. First, before start each cycle of the chemotherapy, all the diagnostic tests are taken. The doctor also will perform the clinical assessment, inspection and palpation on the neck node. Then the patient will undergo the second cycle of the cisplatin-5-fluorouracil chemotherapy from day 1 until day 4. For the first day of the chemotherapy, it starts at 8 a.m. with the pre-chemotherapy hydration. 1 liter of IV normal saline will be administered, and each pint of normal saline add with the 10 mmol of KCl and run 2 hours. At 11 a.m., administer the tablet of epinephrine and lorazepam to the patient. After the hydration, pre-medications such as nitroglycerin, dexamethasone, and IV 10% of mannitol will be given before the chemotherapy drugs. Chemotherapy drugs, IV cisplatin, will run over 2 hours, and then IV 10% mannitol will be run half an hour. After that, continue with the post-chemotherapy hydration, 1 pint of IV normal saline, then followed by the 1 pint of normal saline with 10 mmol of KCl, then followed by the 1 pint of IV Teclos with 1 gram of magnesium sulfate, then last IV 5-fluorouracil in 1 liter normal saline to run over 24 hours in 4 days. For the day 2 till day 4 chemotherapy, tablet lorazepam and IV cisplatin no need to be administered to patient. During the chemotherapy period, monitor the sign of adverse effect. After finish the each cycle of chemotherapy, patient allows to discharge with post-medication, which is tablet of genisetron, tablet of dexamethasone, and tablet of ranitidine. Next, we move to the outcome of the treatment. After administering the medication, the blood glucose level of the patient is within the normal range. Besides that, the reading of the BP also decreased. On 25 October 2019, Mr. Bibin had done his second cycle of the chemotherapy. He was able to tolerate without experiencing any adverse effect during the chemotherapy treatment, and the patient was allowed to discharge with the post-chemotherapy medication.
I will explain the two prioritized nursing care plans for Mr. B. Our first nursing diagnosis is unstable blood glucose level, which is hyperglycemia, related to the lack of adherence to diabetes management, as evidenced by having a random blood sugar level at 16.6 millimole per liter. Our nursing goal is that the patient will maintain a normal fasting blood glucose level at 4 millimole per liter to 6 millimole per liter, and the post-meal blood glucose level of less than 8 millimole per liter throughout the hospitalization. The first nursing intervention is to monitor the patient's blood glucose level hourly to detect any abnormalities so that immediate corrections can be done. Next, educate the patients about balancing food intake with physical activities. This is important in prevent a sudden increase in blood glucose level. Next, advise the patients to cut down on daily carbohydrate intake, because High blood glucose level is usually greatly depends on high consumption of carbohydrates. This should be controlled closely in stabilizing the high blood glucose level. Next, we can administer medication as prescribed, following the 7 rights, such as metformin and gliclazide, to increase the insulin sensitivity to bring down the blood glucose level. The last nursing intervention is to educate the patient on how to check his own blood glucose level by using a glucometer to detect any signs of hypoglycemia or hyperglycemia for immediate medical interventions to be done. Our nursing evaluation is that the patient maintains a normal fasting blood glucose level at 4 millimole per liter to 6 millimole per liter, and a post-meal blood glucose level less than 8 millimole per liter throughout the hospitalization. The second nursing diagnosis is imbalanced nutrition, less than body requirements, related to reduced oral intakes as evidenced by patient verbalize of reduced appetite with difficulty in swallowing, feeling nauseous, and loss of 7 kg over the months. The nursing goal is that the patient will show an increase in appetite and nutritional ingestion sufficient to meet metabolic needs, and a stable weight which is within 10% of the ideal body weight during the hospitalization. First, assess the patient's in difficulty of swallowing. Report to the doctors immediately if the patient is presented with drooling of saliva and having the difficulty in swallowing his own saliva. Next, encourage the patient to take small amounts of food frequently. This is to meet the nutrition needs and also prevent the patients from feeling nauseous due to fullness. Next, discourage caffeinated or carbonated beverages as these beverages will decrease hunger and lead to early satiety. Also, encourage the patient to perform oral hygiene before the meal to remove unpleasant taste and increase his appetite. The next nursing intervention is to administer medication prescribed such as vitamin B complex based on the 7 rights. Vitamin B complex is prescribed to promote cell health, energy level, good digestion, and a healthy appetite. Also, encourage the patient to exercise, because physical activities can help to improve metabolism and absorption of nutrients. Last, report immediately to the doctor if the patient is still having difficulty in swallowing, for an alternative method such as NG feeding, to ensure the patient receives adequate nutrition and calories. The nursing evaluation is that the patient shows an increase in his appetite and show a nutritional ingestion sufficient that meets his metabolic needs, and also a stable weight which is in between 10% of ideal body weight during the hospitalization. The other nursing diagnosis includes altered family process related to the illness of the head of the family member, as evidenced by the inability to perform the role of breadwinner of the family. The next nursing diagnosis is the risk of decreased cardiac output related to the inadequate blood pump by the heart to meet the body metabolic demands. And lastly, the risk of infection related to the side effects of chemotherapy.
Lessons learned from this case are seek medical treatment when noticing something not normal with our body system and compliant with treatment. Secondly, eat balanced diet. And last but not least, stop smoking.